Hey everyone, welcome back to the channel. My name is Chris and I'm a surgical service registrar. And today I wanted to talk to you about 6 lessons that every intern needs to learn before commencing work in the hospital. The first lesson is know how to get stuff done. When you're starting work as a junior doctor, a lot of the work is actually administrative. And when you're a part of the team, the greatest value that you can add to the team is efficiently making things happen. And there's a couple of ways that you can set yourself up for success in that regard. When you're getting a handover, realize that there's always going to be common tasks in every rotation that need to be done. And there's always going to be a more efficient way to get them done. So when you're talking to the person who is doing the job for you, prioritize finding out what those common tasks were and how you can best do them, and whether there were any systems that the people who were there before you put in place that they found really helpful toward the end of the term that maybe you could pick up at the very beginning. The second thing is to realize that administratively, there are always gatekeepers within a hospital, people that allow things to happen. And so if you find out who those people are and you prioritize building relationships with them, it can make life a lot easier. The classic example of this, of course, is medical imaging and finding relationships with people who can make those investigations take place. But it's true in a whole range of different areas. And if you find out during your handover who those gatekeepers are, it can make prioritizing those relationships a lot easier when you're starting on the term. The second lesson is realize that even though a lot of your job is going to be administrative, you are the first line of defense, oftentimes when it comes to patient care. And so if you're on the ward and someone is developing some early signs of deterioration, then being aware of that and applying your known medical skill from medical school to assess that patient safely and escalate your concerns to the appropriate person can make a huge difference to the outcome of somebody who may otherwise be missed. And so it's important to remember that even though a lot of your job is going to be administrative, that you can't forget to be a doctor too, and that your role is just as important as anybody else's in the ward or on the team when it comes to keeping people safe in the hospital. Lesson 3 is remember that you're not better than anybody else. I know that this probably sounds unnecessary to say, that everyone who's watching is probably a really decent human being, but when you're fatigued and when you're stressed and when you're tired and when you're starting in an environment that you're new to and that you haven't worked in before, it can be really easy for your actions and your words to sound really different to the way that you intend. And so being aware of that and being cognizant of the impact that you can have on other people by allowing your stress or your frustration or your anger to leak out is really, really important in terms of maintaining your relationships on the ward and just maintaining your overall mental health. And some of the best ways of dealing with that is to recognize that that can be a problem and then take appropriate action to make sure there are people around you who can call you on it, or at least reach out if they feel as if maybe you're leaning more towards the worst sides of your personality because of the environment or the stress that you're under. The fourth lesson is to remember that there's more to life than this. When you're starting out as a junior doctor, it can be really intimidating. You can be under a lot of pressure, under a lot of stress, and it's a new work environment with new people a lot of the time in which you're rotating constantly. We know from research in Australia, from Beyond Blue, that the scale of the mental health crisis from burnout and suicidal ideation among doctors is extraordinary. And so being aware of that problem and making sure that there are structures around you to support you and that you're reaching out to colleagues who you feel might be having a hard time is a priority when you're starting out as a junior doctor. Building up structures that are going to allow you to have some time outside of work to enjoy your social time and also to act as an early warning system if you feel like you're leaning too far into the stress of work and you've forgotten about the other things in your life that you find important is critical to maintaining the longevity of your career in healthcare. Lesson 5 is learn to be a zero. In his book, An Astronaut's Guide to Life, Canadian astronaut Chris Hadfield talks about a simple way in which people are perceived in teams. He talks about people being either a -1, someone who actively creates problems and takes away value from the team, being a +1, someone who adds value and solves problems for a team, and being a 0, someone who does neither of both of those. And he says that when you're starting in a new environment and you have some skills but you're unfamiliar with the workplace, it's really difficult, if not impossible, to be a +1. At best, you can be a 0, but being a 0 isn't such a bad thing to be. It means that you're not actively creating problems, you're competently performing your job, and you're learning. And when you're an intern, that's a really important mindset to bring into it. It's really easy to think that you have to be better than you actually are. The most important thing to focus on is remember that it's a process. When you come out of medical school, no one's expecting you to have the knowledge of a specialist or be as competent at assessing patients as one of your senior colleagues. They're expecting you to work toward that over time. And the key thing is to remember that that process is going to be difficult, it's going to take time, and you need to be gentle with yourself while you're working through it. The final lesson is to always take responsibility. When you're working in the hospital, invariably, because we're all human, mistakes are going to be made. But rarely is it that the mistake is actually the issue. The issue is when the mistake is not picked up and no one's notified of it, and so it escalates into a larger problem. If you have a complete open disclosure policy, if you feel like you've made an error, then you will find that your reputation will improve accordingly, because people want to work with those that they perceive to be safe. And if you accept your limitations and you accept responsibility for mistakes that you've made when they occur, people will trust you more, and they'll be willing to teach you and to help you and accept when mistakes occur, because you have disclosed what you do and don't know and what has happened and what hasn't happened, and that way patients are kept safe. And really, at the end of the day, that is the most important thing. Alright everyone, thank you so much for watching, and if you're an intern starting out in the hospitals this year, then best of luck with that commencement. I know that everyone's going to be looking out for you, everyone wants you to do as well as you possibly can, and if you see any of us in a more senior position, then please come up and say hi and introduce yourself, and we're wishing you all the best. And until next time, enjoy the work.